Good morning. Such a pleasure to see everyone back through the airwaves, of course, and of course to the online stream that we're having this interview held on Traxx. You can see us by visiting our official Facebook page as well as TRAXXfm official's YouTube channel. My name is Anil on the mic. We are, yes, 11:15. Very punctual. Thank you very much. I got producer Achu on the panels today, handling on the videos, as well as our special guest in the studio. Now, before I introduce our guest to you, let me tell you what is here to actually talk to us about. We are going to learn today about medication for our kids. You know, as parents, as caregivers, as people who look after little kids, it's important for us to know and pay attention to the things that the doctor actually reminds us to do, or rather, you know, the pharmacist. Because after seeing the doctor, we then go to the pharmacist, and the pharmacist tells us, ini makan selepas makan. Ini 2 kali 1 hari. Ini sebelum tidur. Ini jangan makan tau sebab nanti mengantuk. Antibiotic, finish it. We always hear that, isn't it? And today we're going to find out why. Why is it important for us to pay attention to all these details? And to help us with that, we have in the studios Zhen Ning, a pharmacist from Klinik Kesihatan, Tanglin. Good morning, Zhen.
Oh, hi, good morning.
How are you?
Yeah, I'm fine.
Great, great. Looking all in black today. Are you a fan of the New Zealand All Blacks, or is just your fashion choice?
This is just my fashion choice,
Your
I
fashion
guess.
choice, okay. Something very easy and simple. Don't have to crack your head every morning, right? If you just have just very minimal color palettes in your wardrobe, right?
Yeah, true. White, grey, and black.
Ha, nice. Good choice. Anyway, let's start things off. First of all, thank you for setting aside your time on this Monday and being with us. Perhaps I can start off with my first question to you, to understand the importance of knowing the techniques and the methods of taking the right medicines for children.
Hi. Yeah. So, of course, it is important to know the techniques and methods of taking the right medicine for children. So, whenever we talk about medicine for children, so the first thing that comes into my mind would be the safety of the medication, which we often call it as medication safety. And number 2, the efficacy of the medicine. So unlike adult kids, they have a smaller body and their organs are not fully developed. So meaning to say, whatever they take in, the body remove the medicine slower than the adults. So whether it is a prescription or over-the-counter medicine, so medicine for children must be measured accurately because even a small measuring errors can cause large difference in the amount given. And this might cause serious unwanted side effects, or maybe it can proceed to liver or kidney dysfunction. So I would advise parents to always implement the practice of 5R, which is the 5 right concept. So the 5R stands for, the first R would be the right person or the right child. The second R would be the right medicine. The third R would be the right dose. The fourth R will be the right route of administration. And the fifth R will be the right time. So when we bring all this together, so it will be ensuring the right children taking the right medicine with the right dose, with the right route of administration at the right time. So since children, they are still small, they cannot understand the importance of 5R. So parents play a very important role in practice this 5R concept.
Okay, and it's great. It's great that you've pointed out this 5R. At least, you know, parents can have this as a sort of a thought process, isn't it, before they administer medicines to their children. And is there a method? So yes, of course, that is the method you mentioned, 5R, the method to help facilitate the administration of medicines to children. Now, what is the importance then of using the right dosage to give medicines to children? Why is it very important that they have to follow that?
Yeah, you mean the importance of the dosage?
So in this sense, now earlier you mentioned that parents need to pay attention to the 5 R's, which is the right child, the right medicine, the right dosage, the right route of administration, which I believe is the way the medicine is given, whether orally or in the form of tablet or liquid and so on, and then the right time. Now, if these things are not followed, if these things are not done, what are some of the implications, the side effects, so to speak?
Oh, so if it's not being followed, so it would cause a medication error because a slight, like what I said just now. So even a slight measuring errors can cause some serious side effects um, that that's gonna give a big implication or
Right.
big damage to their body.
Okay, okay. So it hence is very important. Can you just backtrack that again and refresh our memory? So the 5 R's, which is the right child, and then the right medicine, the right dosage, the right route of administration, and of course giving it at the right time. So if it's perhaps after a meal or before a meal and so on.
Yeah, correct.
Okay, okay. Thank you, Zhen, for giving us that insight. I think we set the scene really well. Parents have already got this in their mind that the 5 R's have to be paid attention to. We'll jump in for a quick break. When we come back, Health on Tracks will resume. I'm today speaking to Zhen Ning. He is a pharmacist at Klinik Kesihatan Tanglin, and he's talking to us today about the do's and don'ts of medication for kids. Don't go anywhere. Health on Tracks. We'll be right back. Everybody, and welcome back to Health on Tracks right here on Traxx Momentum. I'm Anil on the mic, and our guest today in the studios is Zhen Ning. He's a pharmacist from Klinik Kesihatan Tanglin, and he's today talking to us about medication, the do's and don'ts for kids. Zhen, welcome back to Health on Tracks. Moving on to our next question, apart from using appropriate dosing devices, are there any other ways to facilitate giving medicines to children?
Before I elaborate further, so I would like to point out those main 3 reasons why children, they refuse or they resist to take medication. The first one would be because they cannot swallow the tablets, or they don't like the measuring device. So actually, the doctor would prefer to give syrup or liquid kind of medicine to the kids. So in order for them to take it. So the number 2 reason why usually kids, they don't like to take medicine is because of the taste or the texture. So parents they can talk to their doctors or their pharmacists regarding the availability of some medicines that sometimes comes in various flavors. Like let's say the paracetamol syrup, the fever medicine that we have in the market. We have orange flavor, we have strawberry flavor, we have a bubblegum flavor, or we even we have banana flavor for it. So these various flavors, they will make the medicines more palatable and comfortable for the children to take them. So the reason number 3 would be for older children, they don't understand why they have to take the medicine. That's why they reject them. So if that's the case, parents, they play a very important role. So they need to have a positive attitude to influence their children, be convincing, persistent, gentle, but yet firm when they are trying to explain to their child that this medicine actually they will help them to make them feel better. So it is found to be more effective in persuading children rather than like forcing them or warn them about if you don't take this medicine and I will do this and that to you. So it's not good to be like that. So other than that, parents can also persuade children by giving them appreciation every time when they take their medicine. So verbal praise will make them feel happy and appreciate the medicine. So one tip here is we should avoid referring the medicine as candy, because if we tell our children that okay, this medicine is actually a candy, so this will give a wrong perception to the child. So as in the end, they might end up thinking that okay, this is a candy and I can take it anytime after this. So parents should emphasize that medicine are not candy to avoid unintentional poisoning case.
Just to interrupt you a little bit, we got a question over here that came in from one of our listener audience on TikTok, as we're streaming live on TikTok as well. And this question comes in from Blushing Joy. She asks, she says, "Hello, Zhen. Is it safe to give gripe water to children since they hardly drink plain water?"
Okay, gripe water, the function is to treat bloating. So if let's say the child refuses to drink water, so actually the gripe water doesn't serve the purpose to treat the bloating. I mean, you should encourage the child to drink water instead. But if we are talking about a child, you can always refer to the dosing on the product leaflet that actually they can take the gripe water if they have the indication.
Okay.
And they should avoid, and to be on the safe side, maybe you can consult the doctor regarding the use of gripe water on your child.
All right, Blushing Joyce, I hope that question or your question was answered there by Zhen. Now, Zhen, moving on to my next question here is, it's often assumed that the dose of children, or rather the dosage to administer medicine for children, is half of the adults. And so can medicines in the form of formulations for adults be given to children? And can this lead to medication errors?
So there are 3 questions actually in this question. So I'm going to answer the first one. So a lot of people, they assume that we halve the dose of adult and we give it to children, then it is considered safe. But actually, so the assumption is untrue, because the child's dose is usually determined by the child's body weight and the clinical situation. So we don't do that. So to answer question number 2 and number 3 altogether, so can medicine in the form of formulation of adult to be given to the child, and can it lead to medication error? So to answer that, I would say it is not advisable to give adult formulation to the child, unless if you have the qualification in diagnosing and you have a very strong knowledge about all the ingredients in the medicine, the dose, the frequency, and the timing, everything. So because medication errors, it can happen anywhere along the chain of process, yeah. So among the most common mistakes are the dose and the use of medicine. They are not recommended for the children.
Okay. Now, another important thing that we want to highlight is on the preparation and also storage of medication. Sometimes we keep medication in the refrigerator, sometimes in the closet. So how to choose the right medicine preparation? How should parents keep medicine safely? I think that's should be the question. Yeah.
So, knowledge of preparation and storage of medicine is important to ensure the safety and the efficacy, the effectiveness. So, actually, for the both storage and preparation part, parents they can obtain the information from their healthcare professionals themselves, or they can always like look up from the product leaflet, like whether it should be stored at certain temperatures, or they should be away from light, or how to prepare the medicine. So what I can say is about the preparation part. So most of the medicine were available in the market, they are ready to use, meaning to say just pop up the cap and just pour out and you can drink it straight away. So but certain medicine they need to be reconstituted, meaning to say you have to dissolve in water up to certain level to make up into certain concentration before use. So parents or caregivers, they need to know how to do it, the correct dosage and the method of preparation to ensure the accuracy of the dose. Because otherwise, if the preparation part is wrong, so the dose will be wrong too. So for the storage part, so parents should keep not only children, but also the adult medicine safely. They should keep the medicine away from children to avoid overdose of or misuse of adult medicine, and of course adhere to the temperature, humidity, and away from light thingy, just to make sure that the stability, the effectiveness of the medicine is there.
Right. Okay. Thank you for giving us those updates. So we jump in for another quick break right here on Health on Traxx. Today I'm speaking to Zhen Ning. He's a pharmacist at Klinik Kesihatan Tanglin, and he's today talking to us about the do's and don'ts of medication for kids. Don't go anywhere. Health on Traxx. We'll be right back. welcome back to Health on Traxx Momentum. I'm Anil on the mic, and today with us in the studios, we have Zhen Ning. He's a pharmacist from Klinik Kesihatan, Tanglin. And Zhen is today talking to us about the medication do's and don'ts for kids. Zhen, welcome back to Health on Traxx. Now, earlier on, while we headed in for the break, we were having a very casual conversation, and we touched very briefly on using the house spoons, the spoons that are in the kitchen to administer, or rather to give medicines for our kids. And you said that that shouldn't be the case. Parents should not be using those spoons. Why, and what's the right way to do it?
Oh, that's the reason why we don't use kitchen spoons to measure medicine and give it to, it's either for the children or for adult. Because, like kitchen spoons, they came in various sizes, so it won't be accurate, you see. So the proper measuring or the dosing device for this would be is either the dosing cup or the measuring spoon. So because and these two, they usually, they often comes together with the product. So you can usually get it and measure the correct volume, and just to drink it. So but for smaller kids, where they cannot drink using a cup, so we will advise to use oral syringes.
Yeah.
Or something like a graduated dropper.
Okay. Yeah, I've seen the syringes as well. They would use a syringe, put it into the liquid, and extract the right amount that's necessary for the child, and then administer it for the child.
Yes, correct.
Touching on medicines, earlier on, before the interview, I sort of reenacted the scene that would go on in a clinic or a hospital where we would interact with a pharmacist, and the pharmacist would then say, this one, you got to have it twice a day. Make sure it's after your meal. This is a bit drowsy, so make sure you don't have it if you're going to work or you're driving, blah, blah, blah. And when it comes to the antibiotics, they always remind us to finish it. Why?
Yeah, of course, it is very important to finish the antibiotics because, as we all know, or maybe for those who still don't know about that, so antibiotics, the function of antibiotic is to eradicate bacteria in our body. So to make us feel healthy.
Yeah.
So if let's say, if you're gonna take if you don't adhere the full course of the antibiotic, probably maybe you just take the 2 days out of the 5 days. So the bacteria in the body might not dead totally. So there's a chance that it will cause drug resistance. So meaning to say, if it does happen, so in other words, next time or in the future when you're gonna take the antibiotics again, so it won't work on you.
Right. And I'm also told that antibiotics have a shelf life. That means they have an expiry date. Is that true?
If antibiotics, it actually depends on each product, but most, or what I can say is most of the antibiotic syrups, they can only last for a week or 7 days after reconstitution. So so it's only 7 days.
7 days. Hence why it's important to complete the cycle. Yeah. And how can parents ensure that they're correctly following a healthcare professional's instructions when administering medicines to their children?
So parents, they can ensure they're correctly following the healthcare professional's instructions by first they have to understand the labels. So basically. Just have to read the labels before administer the medicine to their child. So the second point would be you have to clarify any doubts. So if you have any doubts, any questions about the medicine, you can ask your doctor or your pharmacist before you leave, and go back home. So when you're at home, if there's a need to prepare the medicine. So point number 3, you have to properly prepare the medicine. So follow the specific instructions to prepare the medicine, such as add how many water inside and shake before use. And of course, point number 4, you have to use the right dosing device, meaning to say you have to use the oral syringe or the dosing cup or the measuring spoon rather than the kitchen spoon that we mentioned just now. And point number 6, you have to keep track of a medication schedule, meaning to say you shouldn't be skip any dose. Number 7, like what we mentioned just now too, you have to store the medicine correctly according to the specified temperature, humidity, and away from light. And point number 7, you have to monitor the side effects. Number 8, you have to adhere for the full course as instructed by the doctor. And number 9 and number 10, educating themselves. Stay informed about your child's medication and communicate with your healthcare providers. Regularly update them if there's any issues, upcoming issues.
Right. Okay. Lao Zhen Ning, thank you so much for giving us the necessary information we need to know. You, I think, very well extrapolated all the finer details from the 5 R's that you mentioned over the last 30 minutes. Thank you so much. Any final words for our listeners before we let you go for the day?
So final advice, final words for the day. So the bring home message today will be safe use of medicine is the key in treating children. So because of, like what we said just now, because of their physiological condition, so we want the medicine to be delivered to the children as accurate as possible and to minimize or to prevent any sorts of side effects. So parents play a very important role, and by doing or by practicing the 5R concept, which is the right person, the right medicine, the right dose, the right route of administration, and the right time, we will be able to reduce the risk of getting medication error for the children. So anyhow, so if there's any issues, so you can call the National Pharmacy Call Center, NPCC, through 1-800-886722 Monday to Friday from 8 to 6 p.m. But except public holidays, please.
1-800-886722, yeah?
Yep.
Mondays to Fridays, office hours, except for public holidays.
Yes.
So if they got a doubt, they've got to wait for the Monday. Otherwise, they can just walk into the nearest hospital or clinic and get all the advice, or pharmacists to get the help. I'm sure there are many other pharmacists out there just like you who are eager to help. And if I can just add on one line to that, your final parting words, something you mentioned in the first part of our interview. Never tell your kids that medicine is candy.
Yes, correct.
If you can just highlight that once again for our listeners. Why should we not be doing that?
Okay. So we should never tell your children medicine are candies because we want to avoid unintentional poisoning case to happen.
Right. There you go. Something as simple as that, you never know, could lead to something unforeseen, right? They would think, and moreover, medicines, as you mentioned earlier on, have come, flavored so that it makes it easier for them to consume it and, swallow it, and they can get the message mistaken as well.
Yeah, true.
Zhen Ning, thank you so much. You have a lovely day. Look forward to seeing you back again here in the studios. Bye-bye.
Bye. See you.
All right, that was Lao Zhen Ning, a pharmacist from Klinik Kesihatan Tanglin, today talking to us about medication do's and don'ts for kids. If you missed out on that conversation I had with him, you can catch the replay by visiting our official Facebook page or TRAXXfm official's YouTube channel. Coming up in less than 10 minutes, we'll be crossing over to the RTM News Center for the 12 o'clock news flash. And then after that, I'll be back with you for the third leg of Traxx Momentum with more great music and chat you enjoy. Don't go anywhere.